This series is sponsored by our friends at Wild Health, leaders of personalized, genetics-based precision medicine.
The way we take care of ourselves is ever evolving. And what we know for sure is that our mind and spirit are linked to our physical body, and that our wellness seems to extend into our communities and the planet we all share. It is very, very clear that wellness is interconnected. We love spending time with you to explore and practice the breakthroughs, the insights, and the passions of incredible people helping us all see the world in a whole new light. This is Health Gig. On today's Health Gig, we have our great friend, Dr. Matt Dawson. He's the co-founder and CEO of Wild Health, and we have learned so much from his team and really from Matt, so we're thrilled to have him on Health Gig today. Matt, welcome.
I'm always excited to talk to us.
Same here. So let's just start from the beginning. Can you tell us what is precision medicine, how you describe precision medicine, and why you think it is the future?
It's just a personalized approach. It's not a one-size-fits-all. So if you go to a regular traditional physician right now, this isn't a knock on them, it's a knock on the system. They simply don't have time to really take a personalized approach. They may get a few tests, they may talk to you for 7 minutes on average, and then they're going to make recommendations based on what works for most people. But we're not most people, we're individuals. We have bioindividuality, we have specific DNA. Even if you have a study that says this works, what we're saying is this works for 60% or maybe even 70%, but not for everyone. So precision medicine, in my mind, is a very personalized approach. And the way that we approach it is we sequence everyone's DNA. So we go down to the level of the DNA. We look at epigenetics. We look at really deep biometric data. We pull in wearable data about your sleep, about your exercise, your stress levels. And we take those millions of data points and we have a platform that we run that through to give precision medicine recommendations. So it's just a much more personalized approach that we've shown leads to much better outcomes. And that's the point.
So if I'm going to start on wearables, what do I start with? If somebody's just beginning to sort of understand the importance of precision medicine and information gathering, what wearables do you decide or do you suggest?
So we're pretty agnostic to wearables in that we pull all of them into our platform, anything that links to Apple Health or Google Health. So for example, I have an Oura Ring on and an Apple Watch. A lot of our patients will have a Whoop, Fitbit, or other wearables like that. All of that we can pull in. And it's important when thinking about making decisions, like all the time, frequent thing is people have trouble sleeping. Everyone wants to optimize their sleep. So we'll start by looking at DNA and talking to you, like, is it you can't get to sleep, you can't stay asleep, or you're getting up too early? What's the issue? And we'll look at your DNA to see what kind of chronotype you are. And we may look at your labs, like is your magnesium low? So we have all of these variables. And so we're going to make suggestions as to how to optimize your sleep. But then we want to test that with an objective marker. So it's important to look at the data. If I make a recommendation to you and say, let's try magnesium L3 and 8. Well, when you start taking that, I want to see what your sleep was for that week. Because there's 100 things we could do for your sleep. And we'll have a better recommendation because of all the data, but then we need to really have the objective markers of, are we getting success? So that's where the wearables come in.
Is it then like a partnership, I guess, with you, any of the Wild Health doctors, right? So I become responsible for my health in a different kind of way, I think, right? When I start doing precision medicine?
It's a great question, a great point about your responsibility, because on the one hand, we are going to be able to give you much more precise recommendations, but your results are only going to be as good as your ability to implement those. So the word partner you used is ideal, because the physician's job and the health coach's job is to give the recommendations. And then it's also our job to check in with you to see, are you able to follow those recommendations? Are some things we're suggesting, like I may say, eat sardines. You hate sardines, you aren't going to do that. It's a partnership. We need to hear about that, and then we'll make other recommendations. So the partnership word is a great word.
As we started, you were saying what you had for breakfast. Can you tell us what you eat in a day and why you eat that? And then when you're going to talk about protein, tell us about the different types of protein.
Yeah, for sure. So I'll tell you what I eat and why, because it is this kind of personalized approach. So when looking at my genetics, there are a few specific things. I have a FADS2 polymorphism, which that means I don't convert the plant-based form of omega-3 into the active form. And we know how critical omega-3 is for brain health, inflammation, for so many, heart health, so many things. So that means I need more omega-3s. I also have a VDR SNP, which means I need more vitamin D. I also have a collagen 5A1 SNP. So this means that I need more collagen protein. And before I found that out, I was doing Ironman races, doing these long distance events, and I was constantly getting tendon and ligament injuries. And it was because I needed more collagen protein genetically. So when you take all of these, and this is what we do with someone, we take all of these things into account and their blood work. And once we have all of those, then we can make specific recommendations. So like for me, the world's perfect food is a sardine because it has the clean omega-3, it has the collagen protein, and it has a lot of vitamin D because it has the little organs. So the other thing is I'm a fast caffeine metabolizer. So I have a really good effect from caffeine, and it doesn't affect my sleep as much. I don't have a gene called a DORA2A, which makes negatively impact sleep. So you bring all these together, and when I wake up, I'll have my coffee, and I put about 25 grams of collagen protein in it. I will then work out, and then after the workout, I've got a specific kind of whey protein shake, about 25 grams. Then for lunch today, I had 2 cans of sardines. I've got a specific recipe I love where I have guacamole, and I love it. Like my body just craves it. And then in the evening, my wife's a vegetarian, and she usually has like a big vegetarian chili or a lot of vegetables. So I get my kind of fiber intake there, and I've gotten so much protein that whatever protein I can get in the evening is great. And I may do some snacks with these venison sticks. That's for me genetically. When you ask about protein, I think this is an important conversation because so many people are hearing now they need more protein, and people are talking about a gram of protein per pound of body weight. And when people first hear that, they think that's impossible. How am I going to get that? It's not that hard, but what's not discussed is the type of protein and the timing of protein. Probably a year ago, I think most people's belief, the conventional wisdom was that you can't use more than about 25 grams of protein at a time. So to think about for someone like me trying to get 175 to 200 grams, what does that mean? I have to eat 8 servings of 25 grams of protein. A new study in just in the last kind of 6 months that came out showed that we can use more than 25 grams if we eat it correctly and the timing is right. So different types of proteins are broken down and metabolized more quickly than others. So when I wake up in the morning, I've been fasting overnight, and I probably have no circulating amino acids in my blood system, protein. And the 25 grams, where that came from is you can't use more than probably 25 to 30 grams in your bloodstream at a time. That doesn't mean you can't eat more than that. So because I've probably got no circulating amino acids or very low, I eat a very quick protein. So collagen peptides to start, because I'm going to incorporate that through my digestive tract into my bloodstream probably in 15 to 30 minutes really quickly. So now I've got that 25 grams.
So when we go to buy it, is it collagen peptides is that we're looking for?
Collagen peptides, yeah. I like the brand Vital Proteins. It seems to test good, third party, not having a lot of things in it. So that's in my bloodstream, and that's great. I've got it circulating for then when I go and do my workout. After my workout, so I'm a couple hours after that initial 25 grams, then I'm going to, again, have a pretty fast acting protein because I want 25 more grams in after 2 to 3 hours. So I'll eat a whey protein shake. So whey is not quite as fast as collagen peptides, but it's one of the most easily digestible forms of protein. So that's going to get into my system over kind of 30 to 45 minutes.
And what happens to that if you take too much in, something going on in your body? Does your body not know what to do with it, or does it just get rid of it? Does it cause stress?
Protein is for building blocks for our bodies. Protein is not a great source of energy. So if you really want energy, it's more fat for long energy or carbs for quick energy. So if you take more than 25 to 30 grams, your body's going to start using that for energy, but that's not really the point of protein. You would oxidize it and use it, but it's not really it's not the best source of energy.
So you kind of want to take the opportunity to bring in other things at that time for energy.
That's exactly right. So then at lunch, I'll eat a bigger bolus of protein. So I'll have about 50 grams with those sardines. I'm okay taking a bigger bolus because it's a whole food and I'm going to digest it more slowly. So even though I'm eating 50, it's probably going to take 2 hours for it to kind of trickle into my blood system. So I'm still not probably getting more than 25 grams at a time. So then I've got 100 grams. So then I may have an afternoon stack of 2 to 3 of these venison jerky sticks.
Those are so good.
They are. And they're just almost pure protein. And I'm getting 20 to 30 grams. So then I've got 120 to 130 And then dinner at 5:30 or 6 with the family, I'm eating all of those vegetables. So all of that fiber, whatever protein I eat with that, it slows the digestion even more. So if I have another 50 to 70 grams there, that's going to slowly go into my bloodstream over the next 4 to 5 hours with fiber. So I'm trickling it. And even though I took a big bolus in, I'm slowly going to my bloodstream.
So what about like protein from bone broth and protein from lentils? How would you bring those into your diet?
Protein from bone broth is wonderful. So when I talked about the collagen peptides in my coffee, bone broth is collagen protein. It's not quite broken down to peptides. It's not going to be as quickly taken up in the bloodstream because it also has kind of some fat and some other things. So it's going to be slightly slower, but very similar. It's kind of a pure protein. It's wonderful. I drink a lot of bone broth. Lentils, that's very different. So lentils, you're getting protein, but it's from a plant source. One, it's with fiber, so you're going to digest it more slowly. So you could have a bigger bowl. However, plant-based proteins, they're just not quite as bioavailable. If you're getting most of your protein from plants, that's fine. Like I have no problem if someone's a vegan or vegetarian. They just have to keep in mind that they're probably going to need a higher amount of protein to have a similar kind of anabolic effect.
And again, this is all about building muscle, right? And keeping muscle available to us because the less protein we eat, the less muscle we'll create.
So it is about muscle. It's really about everything, though. Protein is a building block for everything. So a lot of people take collagen protein because of its effects on hair and nails and skin. And a lot of people are taking it because of that. So really your entire body, it's not just the muscle. We talk about muscle a lot because it's so important as we age, but it's really all of our connective tissues, skin, and all of that.
I don't know who we were talking to, but they were talking about like in the past, we were eating to be thin. We weren't eating to be strong, particularly women of my age. And so this idea of like adding more protein in, it's a different way of thinking of things. It's not the salad, that kind of idea. So bringing it in is important, but it's a mind shift, especially as we age.
So it's also, though, when I talk to women who really want to focus on being lean, I don't always talk about the muscle components because they don't want to be muscular. First off, women just don't get muscular. Also, protein can be helpful if you are trying to stay lean because it suppresses appetite more. It has a more satiating effect than carbs do, for example. So if you have the same amount of calories, protein or carbs, you're going to get hungry more quickly when it's carbs. So they do have a role when someone's just concerned about body composition.
And you're talking about as we age, the importance of building muscle. And I love hearing you talk about how we want to redefine aging and how you look at aging. And that's why it's sort of not how we necessarily look on the outside, but how our bodies are aging and how we can slow down that aging process, which actually puts us at less risk for cancer, less risk for things. So can you talk about that and how you define aging?
Instead of just my definition of aging, I think it would almost be better to talk about my definition of like optimal health. In my mind, being healthy, what that means is you're able to physically do what you want to do. Just having birthdays is not a bad thing. We don't like piling them up necessarily because all of a sudden we start not being able to do the things we want to do, like play with our grandchildren or great-grandchildren, dance at a wedding, or be able to travel on our own. So my goal is really to help people be able to do those for as long as possible into elevated age. And muscle is a really important part of that. Like we know we have to prevent dementia, heart attack, stroke, these things. But if we're successful with that and we're getting better and better at that, the weak link for a lot of people is going to be just their physical ability to do it. When you get on an airplane, you want to travel, being able to put your luggage in the overhead, get through an airport and make your connection, being able to walk in a new city and enjoy the city without having to sit down, being able to enjoy our life no matter how old we are.
You talk a lot about biological aging and actually our true age. So can you talk about tests that are out there that you use at Wild Health to help us determine that?
Obviously, the main point is the functional things that I mentioned. That's the point. However, it's really good to have some proxies along the way to see like, how are we doing? What is our biologic age? And in the past, if you had asked me 12 to 18 months ago, I would have said, yeah, those tests just aren't really good enough. They're not ready for prime time. I've changed my mind in the last 6 to 9 months. So there's a couple really good tests when it comes to biologic age, specifically around pace of aging, because that's what I really care about. So if I was to measure your biologic age and you're chronologically 40, but biologically 36 or 44, I don't really care that much because I'm going to try to optimize you either way. What I really want to know is right now, what is your pace of aging? So there's a test that Duke developed called the PACE test. So it gives you a score from like 0.6 to 1.4. Are you aging slower than you should or faster? And the reason I like that test is because it's been shown to be sensitive to intervention, meaning if you have a stressor, like actually just getting pregnant is a physiologic stress, that increases your rate of aging by 20%, but it comes back down as soon as you deliver. If you have COVID, have a car accident, any of these stressors, hip surgery, your rate of aging goes up, but it comes back down. So what this allows us to do is to do an intervention with someone. We may say, we're going to change your diet from vegan to an omnivore or an omnivore to vegetarian. And then we can watch how your pace of aging changes. And actually, Stanford did this study. They did a vegan versus omnivore diet looking at people's pace of aging. And just in 8 weeks on a new diet, they saw increases or decreases in age. So allow someone to dial in what's the right diet for them. Does this intervention work? If someone wants to do something really expensive like whole body stem cells in Panama, well, measure a pace of aging before and after and see what kind of effect it has had on you.
And is that a blood test?
What we use at Wild Health is a company called True Diagnostic that just does, it's a dried blood spot card. So they send a card to your house, you do a little finger stick, a little prick, and get a few drops of blood. And then they can tell that pace of aging, and then we can do these interventions.
You talk about stress. So we want to stress our bodies out by cold plunging, right? We want to stress our bodies out by saunas, but we don't want to stress our bodies out with cortisol pumping, right, and stress. How does that work? And how would that affect our pace of aging?
Stress is not bad in the acute sense because like you mentioned, like exercise, cold plunge, sauna, these are acute stressors and your body gets repairs. They're hormetic stresses and they improve your health. The problem is the chronic stress, and it's been shown over and over, study after study, to really have a negative effect on longevity. It's funny, when we've done a lot of these biologic age tests, these pace of aging tests, we'll measure people who are doing, seems like everything right. But what I found is a couple of specific cohorts that really always perform really well. Shift workers, like I used to be an emergency room doctor, so I have a lot of friends who do that. And entrepreneurs and like C-suite executives, we have a lot of those we test. Even when they're doing so much right, the stress from those things really have a negative effect on longevity.
And just being aware of that, I guess, is what you need to know, right? And what do you do to mitigate the stress that we talk so much about?
At some point with those folks, there's usually like a discussion of, obviously you're getting a lot from this job or the stress that you're putting on yourself, but there's a cost so that at some point they can make the decision when it's not worth it when it comes to longevity, or we'll just try to do everything else right as we can and mitigate it.
Which kind of brings us to maybe the role of breath work that you're really teaching us about. Can you talk about breath work and the different kinds of breath works that you think work for people to help them with their stress and to help them use them as tools?
Our breath is something that is with us always and is profoundly impactful, and just being aware of it. From something as simple as box breathing to get to sleep more quickly. In for 4 seconds, hold for 4 seconds. Out for 4 seconds, hold for 4 seconds. Just doing that, it's been shown, one, to help you get to sleep more quickly. If anyone has ever worn an HRV monitor, a heart rate variability monitor, you'll notice profound increases in shifts in your HRV, which is the best measure of your stress when you do these breathing exercises, so you can see it in real time. This was a wake-up moment for me when I wore a device. I think it was called a Leaf device. It's a heart rate monitor. It syncs with your phone and it would alert when your HRV goes too low. I found a couple interesting things. One, I started noticing which people really stress me out. Or, it'll go off and you're like, oh, every time I'm doing email, it's going on. But also what I noticed is then when an alert goes off, it prompts you to do this resonance breathing, just to watch your HRV go up in real time. You see the physiologic effect it's having on the breath. You realize how powerful the breath is.
Do you have any thoughts on nose breathing versus mouth breathing?
We absolutely should be breathing through our nose, especially at night. I've noticed this, so I've actually taped my mouth shut. First, it's very uncomfortable. You have to just start to get used to it. But I notice profound differences in my HRV in the morning. And you're shaking your head like you've had this.
Oh my God. I also tape my mouth. And then I also do the nose spreader, the nose spreader thing. I literally went up 50 points on my HRV. It was actually overnight. It is pretty funny because the tape stuff, I'll wake up and it's like in my hair, or it's in my, you know what I mean? It's like over. So I finally got the brand I like that stays put, and it's made a huge difference. Huge. What is that?
We're meant to breathe through our nose. A lot of things happen when we breathe through our nose that don't happen when we breathe through our mouth. You're cleaning the air with all the air in your nose. You're warming it. And also you're increasing nitric oxide.
So it does make you calmer for sure, because you are just breathing through your nose. There's not that fight or flight feeling, right? Seems like it's deeper breathing.
There is a James Nestor book. It's just called Breathe. And he talks about it a lot and goes deep in the science.
There's a fellow named Matteo Pasteo. Do you know him? The work that he does?
Yeah, so that specifically was holotropic breath work. There's a lot of different forms of it. It's something that I do every time we have a company offsite. It is over breathing. In doing that, you're breathing off a lot of CO2, decreasing CO2, becoming hypocarbic. And it has really interesting effects on the brain. They're almost like psychedelic effects. The person who kind of invented this was a guy named Stan Groff. They did big studies on hundreds of participants at a time. And what they found is about a third of those people, when you're doing it, actually have mystical experiences. Similar amount of people to people doing psychedelics, having these life-changing, life-altering mystical experiences. And it's used therapeutically a lot of times in trauma or other things like that. If you've never done it and you hear people describe it, you're kind of usually rolling your eyes. And then when you do it, you're like, oh, wow.
The idea of having a connection to something greater than ourselves. And that's also a neat way to experience that as well.
And the form that we did it, specifically kind of where we were all connected, and that just tends to open that up. It creates a real incredible connection. It's hard to describe and almost hesitate to describe it on a podcast, but it's a wonderful experience.
What we have to talk about too is the role of AI in health and wellness. And how are you guys using AI, and how do you see it changing the way we're going to be having our relationship with our doctors?
I think this is the first time I'll ever talk about this publicly. In Wild Health, we developed this AI platform to bring in those millions of data points and get precision recommendations. But how we've used it up to this point is with physicians and health coaches delivering the care. And like if you message your doctor or health coach a question, we've built all of that IP on top of a large language model to where the LLM will intersect the question, just like if you're asking ChatGPT a question, and then it gives a recommended answer to the doctor or health coach based on knowing all of your genetics, your past medical history, your blood work, the wearables, everything about you. So it gives a really precision recommendation. We've actually turned that into an app. It's called Hollis, Holis, kind of for holistic. What it does is allows people to have the Wild Health experience without having to pay for the doctor and health coach. So if someone downloads the app, for example, they can order their DNA and genetics, they can order the epigenetics, the true age you talked about, all their blood tests, link up to all of their wearables. The app will collect these millions of data points. It's my favorite app. I've been using it for a while, and it'll give me alerts. It'll tell me things about myself, and I can interact with it, and I can ask it questions. Like I was convinced I was overtraining. I'm feeling tired. I'm like, am I just getting old, or am I overtraining? And so I started talking to it, just typing in, and it's actually got voice too. And I said, I think I'm overtraining. My low back, I'm having some issues. My right shoulder, some issues. Design a workout plan for me based on my HRV trends and everything else to make sure I don't lose muscle, but I do recover from the back thing. So no stress on the back, no stress on the right shoulder, and improve my pickleball game. That's the kind of quadrant it gave me. And it gave me this beautiful thing. It's like, yes, you notice your HRV trend is lower. It does look like you're overtraining. Do these exercises, focus on this, take this out, because it's recording all my workouts every day too. It told me like, hey, lay off on running, the interval workout, switch that to bike for a while this morning. So this morning I did a Peloton workout. I've never done a Peloton workout. I was like, yeah, why didn't I think of this? But it has all of my data. And you can also say like, what should I have for dinner tonight? And it knows your genetics and knows all these things. You could say, give me a 7-day meal plan. I get excited when I'm talking about it because I think it's a way to democratize this and get it out to everybody.
Wow. So can we get it now?
Yes, just on Apple. It's not on Android. And you just order the DNA, the epigenetics, the blood work. And even before you order all those things, you could interact with it and from your wearables. But once it gets that extra data, it gets so much more personalized.
And now it's actually having this conversation with you about you because it has all that information.
Like I gave it the parameters too. Of I want to recover. I don't want to do as much, but I don't want to lose muscle. Whereas if I had said, I would like to lose weight, for example, give me a workout plan and a meal plan. It allows you to journal your food every day and it'll count all of your calories. I'm super excited about it.
Yeah, yeah. It's like a game changer. What do you have to say about what's going on in the women's health world right now and the new studies that are coming out with HRTs and all that kind of stuff?
Women have been treated very poorly in the last 20 years.
Is it true that even tests were always on men, but also on just male mice?
Historically, a lot of studies have excluded women because you're afraid they'll get pregnant and there may be harm to the fetus or something. So it was kind of coming from a good place, but medications, men and women respond so differently to them. A lot of medications that came out, like Ambien is one. It turns out men and women metabolize it very differently, but you don't know that till it's out if you don't actually study women. Now, what you're referring to is an interesting phenomenon when they do a lot of studies, like early studies on with mice. Similar reason to use male mice as female, because also the women are just more complicated with hormones and things. There's probably some other reasons too, but I don't think this is as much anymore. I was referring more to just specifically hormone replacement therapy. The Women's Health Initiative, which it's probably 20 years ago now, it was just misinterpreted so badly that the people doing the study, I think also some of them had a bias and something to prove. And the way that it's just set up in the incentives, it just wasn't interpreted correctly. This is a long discussion. And so I think what I would recommend if someone's really interested in it is a couple things. One, there is a book called Estrogen Matters. It is the most in-depth, wonderful, like, look at this. So if someone is a woman and you're going through menopause, you're getting ready to go through menopause, perimenopause just went through, and you're talking to your doctor and they don't want to put you on hormone replacement therapy, I would read that book. I would ask them their reasons, and I'd probably talk to another physician too. You may have a good reason for it, but most of the time when I see physicians afraid to do hormone replacement therapy, it's because of this old misunderstanding. If you don't have time to read the entire book, Peter Attia did a great podcast with the two authors of that book. So you could probably just search Peter Attia, Estrogen Matters.
Because didn't everybody go off of hormone replacement when the information came out back in the 80s, I guess? Everyone was afraid they were having cancer and that kind of thing. And now they're saying it's kind of shifted back.
But that takes a long time. So there's still a lot of people who are still working with that old paradigm of too risky, it's going to increase your chances of breast cancer. And it's just a tiny theoretical potential increase, but there's so many benefits.
And even now, I think what they're saying is people that are above 60, because I think that used to be it's like 10 years past when you started menopause. And now they're even saying that it's okay for people to go on it after that. I mean, there's nuances, but it's important to research and find that out.
If you are 10 years past, for example, there are some concerns. So then it's a more nuanced discussion.
The other thing that I thought would be so interesting to get your perspective on is how fast things are changing. Like you said at the beginning, you learned a different way to do the protein or fasting now. Could you talk about fasting?
Yeah, fasting is a great example. I think 3 years ago, everyone was fasting. It's like good for what ails you. It's going to fix everything. I was doing it and everybody's either doing intermittent fasting or a 3-day water fast. And there are some benefits. Like we use it in patients, but as a prescriptive thing, like a therapeutic thing, like is there insulin resistance issue? Is there a specific reason for it? But just for everyone to do it, it doesn't necessarily make sense for most people. If we're trying to maintain muscle mass, you may lose on like a 3 to 5 day fast the amount of muscle that it may take you a year to gain that back, especially as you get older. So it's very individualized. If it's a young person, they have insulin resistance, there are specific reasons, great, let's go for it. As we get older, or if our issue is more maintaining muscle than losing weight, a lot of the benefits that people talk about, like autophagy and longevity, they're theoretical benefits. We don't even really know when they kick in. So is there a benefit there? Absolutely. Is it worth the cost is the question in my mind always.
So this intermittent fasting, now you're saying we should maybe relook at that.
It's so individualized. Like for me, like I got a DEXA scan and my visceral fat, which is the bad fat around your organ, I had like 1/6 of a pound. Like there's no visceral fat there. I don't have any risks of being overfed necessarily. My insulin is great. So for me, there's just not really a benefit. And so that's why I have collagen protein in my coffee as soon as I wake up. And then I have a whey protein shake afterwards. I'm struggling to give you like a generalized answer because it's different for every person. Someone like you who has a very good body composition, for you, I'm going to say, no, like let's focus on protein. If someone has a lot of trouble with maintaining their body composition, they're overfed, then it's a good potential solution for them, just restricting the time that you can eat.
We can't skip meals. It's all about putting nutrition in. So it's like what we're putting in. And again, our generation was, oh, we'll skip the meal, we'll lose some weight. We ate to be thin, we exercised to be thin. And now it's this idea of, no, we need to exercise to be strong. We need to eat to be strong. It's just important. And I think what you've taught us is that.
And I think if you focus on the quality of the food, it's so satiating that the body composition is a secondary effect of that.
Exercise, movement. Can you talk about that? And I know what you do is a lot, but can you talk about what you think people should be doing on a regular basis?
Well, and I just admitted that what I do is maybe too much.
Yeah, exactly.
So I tucked into the gym and like I had a challenge last week that I was going to not work out for 3 days. That was my challenge. I don't know if I've ever done that. I don't know if I can do that, but I'm not the normal person. I think in general, there's nothing more important than exercise. Like sleep's critical. But when you look at what has the biggest impact on longevity and everything, it is like just exercise volume, resistance training, moving your body. It just sets off such a cascade of effects and hormones and things. Not just your physical health, which people think about, but your mental health. The exercise review book, I think it was called Spark. And I remember being in awe, like really looking at the data on how much better potentially exercise is than SSRIs for depression and anxiety. That was the first time I'd kind of heard that concept, but it's so important for longevity. It improves your sleep too. We know sleep is important, but it is very much dependent on exercise and movement. The more you're able to move during the day, the better your sleep is going to be as well.
And it's interesting too, as you age, you get busier, maybe you're not moving as much. And then we wonder why we're losing muscle mass. And it's almost like you really got to gear it up.
As you age, you have to be more deliberate about it. And you also have to be more specific in how you start thinking about it and doing it. You don't necessarily just want to get on the treadmill. You really got to kind of mix it up and make sure you're training your balance as well, and the resistance training and doing multiple things and staying balanced.
Balance, you mean sort of do yoga, maybe Pilates, that kind of thing?
Yeah, I used balance in 2 different ways there, so it's kind of confusing.
Balance your exercise and then do balancing exercise.
The balance itself. And so when I talked about balance, those things you mentioned like Pilates and yoga, like doing cross-functional movements is great. I also would say though, when I really talk about balance people, I say just play pickleball or tennis or even golf. You're moving in certain ways, or any sport where you're moving or playing with the kids. Like those are the most functional things is just to play.
That's exactly right, because that's really what we want to be able to do. So might as well start doing it. What do you say about things like when you get the full body MRI, say the Prenuvo, right? And you're aging and it shows your bones are aging. That's just to be expected, correct? And then what do you do with that when you get that information?
We like the Prenuvo, the whole body MRI. We like the Grail test for cancer. We like a lot of these advanced testing. What I would say about them though is you really need to be doing them with someone who understands what they mean and can talk you through it, because as you get older, the Prenuvo is just going to light up. There's going to be lots of things. There's going to be lumbar things. You're going to find all this stuff. You can find cysts and these other things that just happen. And you just want to make sure you're doing it with someone who understands that, yes, these 20 findings we have here, none of them matter. Relax. We're just looking for tumors or like something big here.
And that is the value of it, right? It will find things early. Are we ready for information that we don't know what to do with?
You could go to your doctor and say, order this for me. And if they've never ordered and they don't know what they're looking at, it's not necessarily a good thing, because you could find things that don't matter that lead to future interventions or just worry and anxiety. So you really do need to go into it knowing there's going to be stuff on here, but what we're looking for are these specific things. And then I know that I'm going to have some degeneration. I'm going to have these other things. That's just normal.
Can you just touch on glucose monitors and the importance of stabilizing our sugar levels?
Your metabolic health is really critical. It's maybe one of the biggest things when it comes to cardiovascular disease, dementia, all these things. So we really want to focus on metabolic health, and we really want to have as low of a glucose as we can. And we don't know unless we measure it. So a CGM, or continuous glucose monitor, is a device we just put on, wear for a couple weeks, and monitor. The interesting thing about it is we just learn a lot. It's not something that we'll recommend someone be on forever, but for a period of time, we learn some really interesting things when we have that on someone, like which specific foods cause a glucose spike. So we know that like refined carbohydrates, sugar, pasta, those type of things are going to cause a spike. We start to find some interesting things, potentially inflammatory foods for people that we may not think of as normally would be spiking glucose, but we see a spike with this food that's like milk. Sometimes people have a spike with it when you're like, there's not really a lot of sugar. Like lactose is a sugar, but it's mainly like fat and protein. I'm like, why is this? And then that person may have an MCM6 polymorphism. So genetically, milk is inflammatory for them. You'll also note things like how important sleep is. If you have the exact same food after a good night's sleep versus a bad night's sleep, your glucose spike is going to be much bigger after the poor night's sleep. And you'll learn how to also mitigate those spikes by just simple tricks like going for a walk right before or after dinner, doing even like 50 air squats right before dinner, like activating those big muscles, which just soaks up glucose. You're going to have less of a spike in your system. You'll learn tricks to keep it more steady. You'll learn foods that negatively impact it. You'll learn things like sleep and how behaviors impact it. And after you've worn a glucose monitor for a month or so, you just will have ingested a lot of information that you can then take to keep your blood sugar more steady.
And they're easy to put on, right? And they're not very invasive at all. What else, Matt, haven't we talked about that you think you want everybody to know about?
I tend to, like being the physician and like precision medicine and all that, like we talk a lot about the new and exciting stuff, but I don't want to talk a lot about this because I'm sure you all talk about it all the time, but I feel like I don't talk about connection. I've not done a good job. Study after study, when it's looked at, has shown that connection is going to be the thing that's going to have the biggest impact on your health span and your happiness. That's it. That's why I love coming to you all's conference. Yeah, I would feel bad if I didn't say something about connection. That's it, like more than the devices or anything else.
The idea of opening up your heart, the idea of just taking in it and living from your heart, which is kind of a very healthy way to live.
And we want to like enable you to do that as long as possible. But if you're not doing that, what's the point of us like increasing your lifespan if you're not, don't have the connection and the love?
Well, thank you for being part of the Health Gig, and thanks for the series that we did, the Wild Health series. It's been amazing.
Awesome. Appreciate you having me on so much. It's always awesome.
Thank you for joining us on Health Gig. We loved having you with us. We hope you'll tune in again next week. In the meantime, be sure to like and subscribe to this podcast and follow us on healthgigpod.com. I'm Tricia.
And I'm Doro.
Be well.
Thanks again to Wild Health for helping to make this series possible by sharing valuable insights about personalized healthcare. Wild Health are pioneers in the field of precision medicine, a holistic and genetics-based approach to personalized care. Informed by biometrics, genomics, and lifestyle factors, Wild Health's team of board-certified providers customize health plans with individualized recommendations for diet, exercise, sleep, supplementation, mental health, disease risk reduction, and more. Sign up and get started today at wildhealth.com.